So my name is Eric Gombrich, as you indicated, Chief Revenue Officer for Tickit Health. We were founded in 2012 by Dr. Sandy Whitehouse, a pediatrician who, based on her experience personally, as well as in conversations with her colleagues, started to identify a pretty substantial issue in data capture, particularly when communicating directly with patients. And it's something that oftentimes is hidden or under-recognized, and that is when we come at patients asking for specific information, perhaps through a survey on a piece of paper or a tablet, or even in the clinical encounter, a lot of times patients feel uncomfortable and are unwilling to provide either accurate information or complete information. A really good example that fits in the pediatric context when she was working in the emergency room is walking into the exam room, finding let's say a 10-year-old sitting next to their parent and asking questions about sexual activity, drug use, things along those lines. And of course, the information coming back was going to be what mom wanted to hear, not what the actual truth was. And so she started looking at what are the options and other ways that we may go about capturing more accurate, more complete information from patients. And what was born from that is what we refer to as digital empathy. We developed something we call the digital empathy framework. What the framework is really intended to do is pivot from the context of I as a physician or I as an institution want this information, so I will ask for it, to one that says I as the physician or the institution want this information, and what is the best way of getting it from the particular patient or an individual that we're trying to get it from. So it starts imputing this context of empathy into the data collection process. And when we do that, what we find is that patients find a much greater level of trust in the process. And that opens them up through engagement and encouragement to want to share more information more openly and readily. And the power of this is pretty profound. What we have found is that by applying the digital empathy framework to the data collection process, we not only see a substantial increase in the response rates to assessments, questionnaires, surveys, but also the accuracy or the fidelity in the data. And this is really important when we start doing things like applying that data into machine learning and AI algorithms. We start using the data to screen a heterogeneous population, could be for mental health issues, could be for physical challenges, social determinant issues, all of those types of things. And we're really excited by the results and the impact we're having with this. To give you an idea of what this looks like, on the left is a question. It's really a social determinant question that might be present on a tablet. It could be on a piece of paper, on a clipboard, handed in the waiting room, or it could actually be something that's already in the EHR, the EMR, and the physician or nurse is actually reading this questions to the patient and then getting the answer back. On the right is what a digitally empathetic version of the same question looks like. And you'll notice it seems subtle, but the inclusion of colors, the colors are specifically tuned to the particular culture or ethnicity or gender or age that's being queried for the information. The thumb metaphor is just one metaphor we have from dozens and dozens and dozens of different visual metaphors. But you can see there's a feedback loop here. The thumb rotates to very prominently indicate what answer the individual is giving. The answer is highlighted in color. All of that is triggering biochemical feedbacks in the brain with the individual that causes them to really cognitively consider what information are they providing. You'll also notice that rather than just really simple a string of text, the fonts in the question itself, there's some bolding here, there's some large and small font, things like that. This is all intended to tune the literacy level for, again, the age group and the literacy level of the audience. And so we may ask the same question of different people in that heterogeneous population, but it may be presented in slightly different ways. And that is what's resulting in the profound impact on the results. We've been doing this, like I say, since 2012. We've been doing it in partnership with a number of really well-known organizations. We've been validating it in clinical research and studies, peer-reviewed studies, which we can share with you. A number of them are available on our website. But we are being used in Australia, the United States, and Canada. We're Canadian-based. We're based in Vancouver, Canada right now. And we're really proud of the work that's being done. But here's an example of a particular study and the impact. This was something called the HEADS assessment, another reference to Australia in this meeting. It was done with the Sydney Children's Hospital down in Sydney. And you can see the impact of moving from an interview approach, which is in green, to using the Tickit version, which is in purple, and particularly around the stigmatizing or emotionally challenged questions. You can see the substantial impact on the results. Great feedback, not just from the patients, but also clinic managers, data analysts, et cetera, because of our ability to define and assess the data on the back end that's coming in to drive efficiency within the organization. As I mentioned, we're live in those 3 countries right now. We're being used by health systems, FQHCs, community health, school-based health centers, even outside of healthcare, classic healthcare, in the context of service organizations. The Red Cross is using us, and other organizations like that, helping the homeless and other socially challenged individuals. If you're looking to screen populations, particularly heterogeneous ones, trying to get really difficult information from patients, things along those lines, we would love to hear from you.
Thank you, Eric. We'll jump right into some questions as we're a little short on time. First up, is there a significant benefit beyond pediatric populations, and how?
Yeah, great question. Yeah, as I suggested, we're being used with adult populations. Similar to Yeshai's, one of our clients is a specialty medication provider organization that actually uses us on the front end to capture data from their patients, which substantiates and supports that pre-authorization process. And so that's one example. We're also being used, as I said, by the Canadian Red Cross as they go into disasters for all ages. And yes, so we're being used and by adult hospitals as well. So yeah, this is not limited to pediatrics.
Thank you. And you mentioned over 50 tools in the library. Can you describe some of those?
Yeah, so we have some of the very classic standard validated tools that are used in healthcare, like the PHQ, the GAD-7, HEADS assessment, things along those lines. We also have a number of social determinant assessments, the questionnaire surveys. We have patient or client feedback and patient experience type of surveys, things along those lines. So it's a pretty prolific list of what's in the library. We also do custom work with our partners.
Awesome. And then last question to round it out. Tell us more about how Tickit improves the efficiency of the doctor or the hospital.
Yeah, that's a great question. So one of the ways we do this is by decoupling the need for the doctor or the nurse to actually spend time in a limited encounter asking questions. Now, of course, there's some cases where the physician will want to be asking those questions to get nonverbal feedback and things like that. But we can make that process much more asynchronous, but also engender that level of trust and empathy in the process. So it's not just a questionnaire being sent to somebody. That's one way. And then the second thing is because of the improved fidelity in the data, particularly when you're doing things like screening an entire population, we have much higher sensitivity and much higher specificity in what we're doing. And that allows for much better resource allocation in the care provision process.